That card really should say, God bless the nurse. It's Nurses Week, and I want to take a few minutes to talk about our nurses. Doesn't really matter whether we're talking about MAs, LVNs, LPNs, RNs, NPs. Anyone who's a nurse who cares for patients deserves the Purple Heart, the gold medal, the Nobel Prize. In times like this, nurses are getting a lot of credit, as they much deserve, for all the work they do day in, day out, but their true bravery has really shined through in the last several months. I want to take a moment to talk about nurses. It's hard to say what it is that I appreciate most about nurses, other than I couldn't survive without my nurses, my MAs, my NPs, my RNs that I work with. And I say my, I don't own them. I'm just blessed that I get to work with them, and they're family to me. I don't know whether it's because they're great people wrapped in a nurse's degree with the mind of a scientist and physician. It's really hard to define, but I guess what defines them most is their devotion to our patients, to their patients. They are hell-bent on doing the right thing. If something needs to be done, if there's a nurse involved in the plan, it's likely it's going to happen, and then some. I think it's really, really important that nurses be involved when trying to get things right, and certainly when things are going wrong. It's because you don't have a good nurse involved. It's an old saying back from my hockey days that only God saves more than nurses. Lord knows, nurses I've worked with have saved me from myself, from my errors, from the mistakes of others, from infopenia that they seem to replenish and correct. They saved me from the patients themselves. Without their intervention, it's hard to say where that might have gone. They seem to be blessed with patience, ENTS, and patience, ENCE. That's what makes the combination so great. They are really much better than I am at listening and actually hearing and understanding what's important to patients and turning that into action. Actions that cut through and get things done in a very, very noticeable way. Patients probably align themselves better with nurses than with physicians, and physicians should work at what it is they need to do to emulate that. I think a good nurse is really typified by the word dependable. They're dependable like a Swiss Army watch, a Swiss watch. Everybody knows that. The patients know that. Administrators know that. The other docs know it. The nurses are who you go to. Dependability is what defines professionalism. And they are professionals even without having the highest of degrees. They show up, they do the work, they do the thankless work, they do the work that needs to be done, and they should be appreciated for it on a regular basis. They should be paid for it in a very measurable way. If you want anything in this life, the one adjective you want to attach to it is dependable. We're talking about furniture, we're talking about cell phones, we're talking about carnival rides, and most of all, we're talking about nurses. Again, dependability is what makes them so golden to everything that I want to do in a clinic situation. I can't tell you how many times I've heard the words, "Oh, it's okay, Dr. Cush. Don't you worry. I'll just talk to the nurse. Jackie will take care of it." And they do. And the patients know that because it's the nurse who's dependable. The doctor, pretty dependable, but we don't quite measure up. I'll end by saying that to every day go into battle with a nurse is an amazing thing. It arms me with a tremendous advantage in having a great day at work that will benefit a lot of patients. And it's really because of the partnership I have with nurses. So if you're a nurse, bless you, love you, can't give you enough respect for what you do. You should feel very appreciated this week and every week. Please show this video to your mother, your sister, your spouse, your boss, anyone who might need to have a better understanding as to how important you are in our clinics, in our hospitals, in our daily delivery of health care. If you're a doc, wake up. Send your nurse a message. Tell them, you're the best. You have no idea how much I appreciate you. This whole operation works because of you. God bless the nurse.